Good morning. This is Chandrasekhar, KC, founder and CEO of Forus Health. We've been working on this mission of eradicating avoidable blindness for the last 10 years. We've created products, platforms, artificial intelligence, and continuing in our mission. Over the last 90 to 100 days, we have been facing very unprecedented times where COVID has really affected the world at large and India also. Most of the eye hospitals have been kind of shut down for the last 80, 90 days and finding it very difficult to open up because customers are also very worried to come to the hospital and come for treatment. So this last 60, 70 days has given us phenomenal amount of introspection. How do we continue to work on our mission in the current situation and not deviate too much from where we want to go and what we want to achieve? And that's where this book on the 7 sutras of innovation have continued to be my guide. The key things which we have focused on, the sutras given in the book, the customer centricity, the culture of innovation, capital consciousness, and amplification of vision. So if you really look at what we are trying to do now, we are trying to create a complete digital platform which will help doctors connect to patient even in this time of COVID. And this is being done by our own team. So we are very, very conscious of not spending money on that. And very importantly, it is driven from a customer standpoint because the customer who's at home should not go blind because he's not going to the doctor. So how do we ensure from his home he can connect to the doctor and ensure that he's consistently monitored? The third, obviously, most critical is the culture of innovation, where we need to innovate. We need to innovate. How do we reach the patient? So whether the app or probably some of the devices which we'll create for home is the innovation which we are doing, and also the disease management part of this. And if you really look at it from a vision standpoint, we are now looking at a larger perspective that not only we are screening people at early stage, but also ensuring people who are chronically having an eye problem will be continuously monitored at home, even in the current and future situations, and ensure that they don't go blind. I really thank the concepts behind this book, which also enlightened us to kind of think through. And I hope we will continue in our mission of eradicating avoidable blindness. Thank you very much.